Physiotherapists are trained professionals whose focus is on improving impaired function, in other words, how mobile people are. We also have an emphasis on education and self-management, which is very important. My philosophy is to deliver gentle but effective treatment that helps people get back to their normal lives as quickly as possible. I like to treat each person as an individual and to make them feel as if their problem is important to me as well as to them. I care about the outcome of their treatment. I care about getting them back to the community and getting them functioning again. I like to work with the person and try to meet their needs. So I think it's important to actually identify what the person's needs are when they first come in, and then aim your treatment and rehabilitation around that. When you come in for physiotherapy, I will treat you. I have in the past employed other physiotherapists, but now at this stage in my career, I'm really enjoying just being the sole practitioner and giving that care to people on an individual basis. We allow a half-hour appointment for our first visit. That gives both me and the person time to explore their problem. They can then have time to give me a good history, which helps me then make a diagnosis. It gives me adequate time to fully assess them and to make sure that their problem is something I should be dealing with and that they don't have any other serious problems there underlying the pain or disability that's brought them into us. Most problems people have are treated with gentle techniques to improve mobility, followed by exercises or a retraining of the way someone moves to enhance that improved mobility. Humans generally need to be able to use an exercise or a movement and keep maintaining that all the time through their day. So if I train someone to get up and down from sitting correctly, I feel that's a much better way for them to strengthen their back muscles than to lie down on the floor and do some strengthening exercises. There are times when you do need to lie down to do exercise, but then you need to be able to take it away and use it when you sit in the office and when you get up and down from sitting. In a way that can be helpful for people to have a good memory of how to move is to use strapping as a support, and also to help muscles work more efficiently, and helps people realise when they're going beyond the limits. I'm sure some people have had painful experiences with physiotherapy, but to me, and in the way I practice, I don't think physiotherapy should ever be painful. Pain and healing, to me, don't go together. The physiotherapist should always be querying whether you're comfortable and whether what they're doing to you is hurting or not hurting. When I was teaching physiotherapists to do manipulation, I would always encourage them to back their pressure and force right off. You can't feel what you're doing if your grip is strong. You need to touch lightly and gently to sense joints under your hands. And when you use techniques that are gross or rough, you're losing a sense of joint feel, which you need to deliver gentle and effective technique. I see a lot of problems that are left quite a long time before people actually seek help. The basic healing process occurs over a 3-week period, and the best time to actually seek help, to help that process happen, I would suggest within the first 3 days after significant injury or trauma. If it's something where people feel that they're comfortable coming straight to a physiotherapist, that's very common. And in fact, it's useful because it can mean that you get help a little bit more quickly if you do come straight in. And then if there is a need to send people further, if we're not comfortable with the person's problem, we need to seek another opinion, then we refer back to a doctor. If there's an x-ray needed, and we have pretty strict criteria that we use to determine that, we will then, we can refer for an x-ray as well.